back, a single dose of monoclonal antibody cocktail, something that former US President Donald Trump took, is the latest treatment option available to COVID patients in the high-risk category. Sudhir speaks to Dr Nageshwar Reddy of the Asian Institute of Gastroenterology that has given the shot to 40 patients already and is carrying out one of the largest studies on this therapy.
Monoclonal antibodies therapy, something that came into limelight with President Donald Trump actually taking it first, but after India has approved it, Asian Institute of Gastroenterology is in fact carrying out a huge study to find out if it works also against the Indian variant. I have with me the chairperson of the Asian Institute of Gastroenterology, Dr Nageshwar Reddy. What is the kind of study that you're carrying out? Already I understand 40 patients have received this therapy.
Yeah. Since monoclonal antibodies have come to India only recently, they are a cocktail of two antibodies which are specifically made from a single beta B cell to produce high amount of antibodies which go and get attached to the spike protein to prevent the virus from entering into the cells and therefore preventing the disease. So these antibodies have shown to be very effective for mild to moderate cases so that they don't proceed to become severe cases. So if you take 100 cases of COVID, about 5 would become severe, but there are certain categories of patients who have comorbid conditions, especially those above 65 years, those who are obese, those who have type 2 diabetes which is not controlled, or chronic kidney disease, or immunosuppressed, coronary artery disease, obstructive airway disease. All these people have a tendency to become serious, 20-30% of them. So in this group of patients, if you give monoclonal antibodies, usually within 7 days of getting the virus or within 3 days after testing, then you can prevent these people from going into a serious disease. That is, they remain mild, moderate, and then recover very rapidly. So we have used this now in 40 patients in our institution over the period of last 2 weeks since this is available. And what we're doing is very important to study actually how effective it is against the Indian variant. Studies from US have shown that this is effective against the British variant, against the Brazilian, South African variants. It's effective. But nobody has tested it against the Indian double mutant variant that we have here. So what we're doing is we're parallelly, as we're giving these patients this, we are testing whether it's really effective against the mutant virus. So all the patients in whom this monoclonal is being given, the genomic sequence of the virus also is being done simultaneously. We are running a parallel group of patients who are getting conventional treatment. Again, genomic sequence of this patient's virus also is being done. So then we will know the results in another 2 weeks when we finish the 100 patients to see how effective this is. From the results that we have now, we have found that in the 40 patients whom we analyzed after 1 week, almost 100% of them the virus has completely disappeared when you do the RT-PCR. And in 24 hours, all of them have recovered from the clinical symptomatology, fever, malaise and so on. So on the face it looks like it's effective, but we really have to match the mutants along with this patients in whom we are given this to say that it's really effective.
What is the cost that you're talking about? And outside the country, it seems to be much more expensive than in the country.
Yeah. So in India, the cost is coming to about 70,000 rupees per dose. It's a single dose drug, only one dose. Whereas in United States, the cost is anywhere between 10 to 30,000 US dollars, which is almost 20 times the cost what we have in India.
So who is the candidate? You mentioned the different categories of vulnerabilities. Are you offer this as a treatment to them? Is there any other side to it in the sense of after effects and so on and so forth?
Yeah, so this is an important question. Generally, we offer it to only certain group of people who are at high risk of developing a serious disease. For example, those above the age of 65 years, obese, type 2 diabetes and so on. Only this group of people specifically get it. What we have found is that once you give this, the efficacy is very high. The only caveat is that they can't take a vaccine for at least 3 months after giving this. The reason is the antibodies are circulating in their system, and if you give a vaccine, it will get neutralized. The efficacy of vaccine won't be so high. So what we are suggesting now is that once you take the monoclonal antibodies, wait for 3 months before you take the vaccine. But then anyway, they're protected in these 3 months. So there's no problem, no harm. It's just that you delay taking the vaccine at a later date.
As of now, when people are talking about lakhs of rupees in treatment and lots of days of hospital stay, there is a danger of abuse of this, isn't it? I mean, because 70,000 seems like, okay, one day, your shorter hospital stay and much cheaper.
Yeah, you're absolutely right. Because it looks so attractive we're getting a lot of calls from all over the country, people saying we want to come and take this single shot therapy because although it looks 70,000, it's cheaper than getting hospitalized and treated. But we have to be very careful that this should not be misused, and the most important thing is we should not misuse this drug. It has to be given only under specific indication as authorized by the Ministry of Health under emergency use authorization, only the specific indication, because if it's overused, what's going to happen is there's a possibility that of course the cost factor involved, but also more mutant viruses can come from this. So we have to be very careful that we don't abuse this drug. It has to be carefully used in selected populations.